Assalamu alaikum. I'm Dr. Talhashfiq and you are watching Pakistan Veterinary Education. So today we are going to start a series of video on veterinary radiography of different body systems. And in this video, I'm going to talk about very basic concepts of the radiography of the skeleton system. So we are going to cover what is the response of the bone to any type of injury or any type of disease. It means whenever there is some type of injury or some type of trauma, or sometimes there may be metabolic changes in the bone, what can be possible radiographical signs, or you can say radiological signs, that we can notice in a radiograph. So the first response you can notice on a radiograph is decreased density. That means some area or some part of the bone on a radiograph looks more grayish or sometimes more black. Similarly, in some conditions, density of the bone increases, and then sometimes different periosteal reactions may take place in different situations. The fourth one is change in the size or the contour of the bone, and the last one is change in the trabecular pattern. Let's start all the responses of the bone one by one. Number one is decreased density. The density of the bone sometimes decrease due to many factors, like there may be trauma, there may be metabolic disease. Sometimes there is a decreased density due to inflammation or the neoplastic growth, and there are many other factors in which density of the bone decreases. Decrease in density basically means demineralization of the bone, so radiographic shadow becomes somewhat black to dark gray. If we are talking about the normal shadow, it is black. You know that the normal shadow of any object that come in the path of light, it becomes black. But in case of radiology, radiographic shadows become white that come under the path of any type of X-ray. So it all depends upon the density of the tissue. The more dense tissue becomes more whitish, you will look on the radiograph. In some other video, we will talk about it in very detail. Look at this radiograph. The arrows that are directing towards the lytic changes on the bone, and the bone density decreases at these spots. So the radiographic shadow at these spots become grayish black as compared to the other bone. So the next one is increased density. Increased density is also one of the bone response, and it is always associated with increased mineralization. Decreased density is related with the decreased mineralization, and so due to decreased mineralization, the density of the bone decreases. But in this case, whenever there is increased density, there will be increased mineralization or the calcification on the bone under any response of the inflammation, or you can say that there may be healing process is going on. It may also due to continued abnormal stress. There will be cortical thickening, that is basically hypertrophy of the bone cortex. In all such cases where there is increased bone density, bone spots on the radiograph look more whitish than normal. Radiographically, we'll call it sclerosis. So, what is sclerosis? If there is increased in the bone density and there is a hardening of the bone, you will see on the radiograph that the shadow becomes more whitish. Radiographically, we call it sclerosis. In this radiograph, you can see the stifle joint that becomes very sclerotic due to increased mineralization under the response of some type of inflammation. Then there is a periosteal reaction that is very important in osteomyelitis, bone tumors. Either it may be benign or sometimes it may be malignant, and some many other condition. Periosteal reaction is very important. Whenever there is elevation of the periosteum or there is a periosteal reaction, it may be laminated like onion skin like. Sometimes it is palisade like. sometimes it is radiating just like sunburst, sometimes it is spiculated. Here are cilia like growth, Codman's triangle, sometimes it is so bubble like. So these are all the periosteal reaction. One by one we will discuss in the with the diagram. For this you should know, in case of any type of benign tumor, periosteal reaction becomes smooth and intact, while in case of uh, malignant tumor, whenever there is a broken or interrupted pattern on the bone in a radiograph, you will look such periosteal pattern on a radiograph. It's clear indication of malignancy. But you should know, without a histopathology, don't give any type of confirmatory diagnosis. Here we have some schematic periosteal reactions, schematic diagram, and in which different periosteal reactions are shown and categorized according to the continuous and interrupted pattern. In continuous pattern, first we will discuss about the continuous pattern. In continuous pattern, elevation of the bone may be eggshell like or sometimes lobulated, or sometimes you are seeing that it may be soap bubble like. Whenever periosteal reaction or periosteal elevation is filled with the solid mass that may be bone, it is called solid periosteal reaction. Similarly, if a layer of periosteum elevates, it will be called single layer periosteal reaction. And when there are multiple layers that are involving and that are covering the periosteum, just like an onion skin, it is called multi-layered periosteal reaction. Sometimes you will get some type of spicules just like here on the end, on the periosteal end. It is called spiculated periosteal reaction. The next one is periosteum. Whenever just look like a burst, a sunburst, it is known as sunburst periosteal reaction. No, in case of the interrupted periosteal reaction, it may be wedge shaped, it may be Codman's triangle shaped, it may be sometimes interrupted onion skins that are just like continuous, and sometimes it may be interrupted spicules, or you can say interrupted hair like growths. No, these are also some other type of schematic periosteal reaction on a bone that give us a very good concept. Just take a very quick look on these reactions. So this is normal periosteum. Here is a solid periosteal reaction. You can see it is filled with some type of solid material. And this one is irregular solid periosteal reaction. No, this is single layer elevation of the periosteum, and in the very next diagram, layers are going to be multiple, and we call it onion skin multi-layered periosteal reaction. No, this is a hair-like periosteal reaction on the periosteum. This is sunburst periosteal reaction. Next one is disorganized type of solid periosteal elevation. Mostly it occurs in tumors. This is Codman's triangle periosteal reaction. No, I think the basic concept about the periosteal reaction is going very clear. So look at this radiograph. It's very clear Codman's triangle on the periosteum of a bone. Here in this radiograph, you can see single layered periosteal elevation on both cortex of the bone. Now, this is so bubble periosteal reaction, and the next one is hair-like or spiculated periosteal reaction. Now at this bone you can see that a single layered elevation, but on other periosteum it's sunburst like periosteal reaction. Next one is change in size or the contour. First, you should know what is the contour. Contour is basically shape of the bone. Whenever we are talking about the contour, we are talking about the shape of the bone. So, change in size or the contour is always associated, or you can say it is always under the response of any type of disease or trauma during growth period. During growth, if the bone gets some type of fracture, that may be pathological or that may be physical fracture, but the thing is, radiographically when we see it, it is just look like this. Here you can see that this is not normal contour, or you can say that normal size of the bone. Change in the trabecular pattern is also very important bone response. Trabeculae, first I want to clear what are the trabeculae. Trabeculae are the small beams that may be spongy or sometimes may be porous, composed of hard and soft tissue components. These are mostly found at the epiphysis and metaphysis of the long bones and vertebral bodies, but they will fade out at the diaphysis. You should know it is very important whenever there is some indication of the disease, there will be change in the trabecular pattern. Here you can clearly see change in the trabecular pattern of a bone radiographically. So in this video, we have covered what is the response of the bone to any type of injury or disease. I hope you understand it with the radiographs whenever there is a response of the bone to any type of injury or disease. Please like the video, and if you are new on our channel, then please subscribe it for new videos.